Good afternoon. My name is Dr. Petrikovsky. I'm a professor of obstetrics and gynecology, and the views expressed in this video does necessarily agree with the views of the institution I'm affiliated with. In all our previous videos, we talk enough, I think, about hydrochloroquine, but there is a new and alarming development in that particular issue. And as I promised, I really tried to stay to peer review articles and trying to inform my patients and colleagues on what's been reviewed and consider valid, at least for the time being. Although most of the information on coronavirus is evolving as the disease progresses, as we know more about things. For example, the political call for more testing is not necessarily reasonable. Antibody testing are not as accurate, but this particular piece of news that I received recently is very alarming. And this is the researchers who published fake articles on hydrochloroquine in Lancet and New England Journal of Medicine lost their academic appointments. And that's extremely alarming in the academic world. Clearly, both Lancet and New England Journal of Medicine retracted the articles. They questioned the data, and now they're saying that the data was related also to a company called Surgisphere, and the data on use of hydrochloroquine in treatment of coronavirus infection, it's more likely unreliable and not put together in a good faith and good fashion. And clearly, it's extremely rare when the faculty is removed from the academic institution or the academic appointments is terminated. There is no details, but it should be grave enough for such an action. And I just want to reiterate one more time that the whole idea of hydrochloroquine is prevention, not the treatment of coronavirus infection. At this point, we have antiviral medication, we had dexamethasone, and those are the treatment remedies. As far as hydrochloroquine, it was, is, and will be a protective mechanism, more like prevention than a treatment, because the whole idea of this medication is to decrease multiplication of the viruses rather than treatment the effect of the viruses on the body. We said that dexamethasone is actually handling the body response to virus and protects body from the virus, limiting so-called cytokine storm and saves lives. So clearly, before reading and relying on certain, I would say, unscrupulous publications and certain data that may be not necessarily correct, I think both patients and doctors should do their own analysis and pay attention to the truth. Thank you and stay safe.